As a rule, basic rule is once a year. It will depend on your age, your skin type, and your risk factors. Some patients, especially younger patients, darker skin types might not need to come in every year. Some patients, older patients, lots of sun damage will need to come in more often. In Australia, skin cancer is extremely prevalent. We've just been at a conference today highlighting how much more skin cancer we have in Australia and New Zealand compared to the rest of the world. And part of that is because of how strong the UV is in Australia and also our lifestyle because we have such a nice, beautiful, sunny country. As a result of that, we get to love the sun, but the sun, unfortunately, sometimes doesn't love us back as much. So it's very important to get regular skin checks. Early detection of skin cancers will reduce your risk of death or damage from skin cancer. Early detection is very important because if we can detect most cancers when they're small and when they're early, it means that firstly, the excision is much smaller if we do the treatment, or sometimes we can even do topical treatments. Secondly, if a lesion is caught early, it means that the risk of recurrence of a lesion is much lower. So every time we remove a cancer, we aim to have it fully removed. It's completely cured, but there is a separate risk factor, which is the recurrence rate. It doesn't mean that this cancer wasn't cured, but it's sometimes the cells around the area of the skin have already been damaged. Sometimes it is a more aggressive type of cancer that there is a small chance in several years' time that the cancer might return back to the same spot. So the earlier we can catch the cancer, the better our cure rates and the lower the recurrence rate.